Good afternoon, all. So now we are going to discuss on the topic community health bag. Community health bag. So as we know, what is the meaning of bag? What is the meaning of bag? Bag is nothing but it is a pouch. It is a pouch like structure. Like there are so many designed, so many different kinds of bags are there. We are taking and we are carrying our belongings. We are carrying day to day our like school bag, college bag, then traveling bag. There are so many different kind of bags we are using for day to day our life. But when we are talking about the community health bag, it is totally different from the usual bag. It is specially designed for the community health nursing. The community health bag is specially designed for community health nursing and we are using for giving community health services, especially when we are doing the home visit. When we are doing the home visit, we are taking we are taking this community health bag. With the help of this, we are carrying all the necessary articles which and all required for performing the nursing procedures at the doorstep during our home visit. Okay, so now moving towards, you see the pictures how the community health bag is. So many there are so many compartments are there, and all the instruments, how what and all we are taking, the basic instrument, basic articles we are taking, we are keeping in this, and we are carrying during our home visit. It is helping for carrying the to provide the nursing procedure or to give nursing care to the family members or to the patients at their doorstep. So how to do this, like what is the like there also as a community health nurse, as a nurse you should have some knowledge, you should know, you should be skilled how to prepare this one, which and all things, where to keep, how to carry, how to protect this bag, how to care this bag, each and everything. Okay, so today we are going to study of this only. What is the meaning of community health bag, what is the meaning of community this bag technique, how to do, how to care of this bag on, what is the procedure of this one, what are all the items we can keep, what are all the articles, which and all compartments we are going to use. All those things we are going to study in this topic today. So you see, so now definition of the community health bag. So first definition, that is community health bag is the vehicle for carrying the tools needed during a home visit. Okay, we have studied the home visit, right? Home visit. So during our home visit as a community health nurse, it is helping for carrying all the articles, all the tools. It is acting as a vehicle for carrying all the tools needed during a home visit. It is given by TNI, Trained Nurses Association of India. The next definition of the community health bag, that is tells community health bag is the carrier containing the tools. It is a carrier. It is a carrier which is containing what? Tools. It is meant articles like stethoscope, then forceps, solution bottles, spirit lamp. There are so many articles, so many tools, equipments and materials needed during the nurses' visits to home for performing nursing intervention, which includes various diagnostic test, demonstration of care, as well as patient care activities. So the community health bag is the bag or carrier which is containing all the articles which is necessary to perform a task, to give care to the patient at their doorstep. Like diagnostic tests, various diagnostic tests is nothing but, for example, one patient is there, diabetes patient in one home. Okay, so as we know, what is the meaning of diabetes? Blood glucose level will be high. So you have to like periodically they have to check the blood glucose level. As well as we know, the complications of diabetes is the common complication like kidney damage. It will damage the kidney. So whether how much we can check the glucose level, for that we have to take one articles. So with the help of, we will be keeping the articles in that community bag and will carry. So this will be helping for what? To perform this diagnostic test, as well as the presence of glucose in the urine, presence of protein in the urine. How we'll check? Like functions, the kidney function, whether it is normal or not, whether due to diabetes, whether it is complicated or not, the kidney function has damaged or not, or any kidney defect is there or not. Okay, it has affected or not. So we can check by presence of glucose, presence of glucose in urine, as well as presence of protein in urine. So if it is, how it will do? By urine examination or urine test. So for doing the urine test, we need something, right? We need test tube, we need test tube holder, we need spirit lamp, we need articles, we need solutions, Benedict solution, acetic acid solution. Benedict solution is required for checking glucose, presence of glucose in urine. Acetic acid is required for checking presence of protein in urine. Okay, so this is the diagnostic test. Okay, if it is present, the protein and glucose is present in the urine, it's showing that what? The diabetes is affecting the kidney, right? Affecting the kidney. If it is not normal, it means the kidney functioning is normal. Kidney function is normal. As well as demonstration of care. Demonstration of care is nothing but what? The students will be going for the posting, community health posting, community health nursing posting. So as a teacher, they should show how to do all those things. So this, for the demonstration of care, they should show this one, as well as the patient care activities. So the community health bag is a carrier containing tools, equipment, materials, whatever it is required during the home visit for performing nursing intervention, which includes various diagnostic tests, demonstration of care, as well as patient care activities. Okay. The next is bag technique. Community health bag and bag technique. So we know now what is the meaning of community health bag. Now moving towards the bag technique. So definition of the bag techniques. Okay, bag is nothing but is like a pen will be somewhere, then book will be somewhere, the instrument will be somewhere. It is not like a school college bag. The community health bag, when we are preparing, we should have some skills. We should have some technique how to do this one. So the bag technique is refers to the skill and knowledge in preparing as well as and using materials and equipment in the community health bag for performing various nursing intervention at home. It is means what? Bag technique is nothing but preparation of the bag. So for that you should have the skill and knowledge in preparing and using of materials and equipment in the community health bag. In that bag, how to keep, where to keep, which compartment, which which compartment, which solution we are going to keep, which compartment, which medications we are going to keep, which compartment we are going to give keep the test tube, all those things. So this bag technique is telling, it is refers to the skills and knowledge in preparing. As a community health nurse, you should have the skills and knowledge in preparing as well as the using of materials and equipments in the community health bag for performing various nursing intervention at home. Various nursing intervention at home, because we are using this community health bag during our home visit. Okay. Next, moving towards the purposes. What is the purpose of using this one, using bag? What is the purpose of using this bag? Bag is helping for us what? As a community health nurse, we will go for the home visit. What is helping? What is the purpose of using? As a community health nurse, you are going to use this one. It is helping for assessing the individual as well as the family health, right? Like for example, I have given diabetes patient. You are going to assess the diabetes, how much the glucose level, whether presence of whether kidney is functioning normally or not, whether the diabetes has complicated to the kidney function or not, like glucose and presence of glucose and presence of protein you are going to check in urine. So thereby you are going to assess, right? Assess the health needs of the individual and family. Like some children are there malnourished, so you are having the tape, okay, measuring tape. So with the help of measuring tape, you can check their growth, like anthropometric measurement, head circumference, chest circumference, medium circumference, length of the body. I said that is height of the body. Okay. So if it is not normal, you can identify. So that is only to assess the needs of the individual and family. The next is to provide emergency first aid. Okay, emergency first aid. Like somebody has met with like little minor accidents, or maybe the children are playing suddenly fall down. So like from the knee or elbow, like little bleeding, it is there. So you can give. It will be helping for, because in that bag you will be having the bandage kit or like Dettol solution, Sablon solution, all those things, antiseptic solution, all those. The next is to provide primary medical care in case of acute and communicable disease. It is helping for giving the primary medical care in case of acute and chronic communicable diseases. Like what? Communicable disease like common cold. For example, common cold. If the patient is having common cold and fever, one person in the family, during your home visit, you can give medications. Okay, some of the medications will be common medications will be carrying in this community health bag. Okay, so that you can give acute care. The next is to provide antenatal, postnatal and intranatal care to mothers. To provide antenatal, intranatal and postnatal care to the mothers is something but what? Antenatal is nothing but the period of pregnancy. Period of pregnancy. Like before the delivery, till how many days? That is called antenatal period. Anti means pre or before. Natal means delivery. So pre-delivery, during the pregnancy. Postnatal means after the delivery. After the delivery till 6th week of this delivery, till 42 days after. The next, that is called puerperal period also. Then intranatal. Intranatal care is something but the time of delivery, during birth, during the childbirth, you can give care to the mothers. Okay, you will be having so many care to give care, so many articles, so many instrument is in there. Sorry, in that community health bag you are going to carry. So this, to provide antenatal, postnatal and intranatal care to the mothers, we need this community health bag. Okay. The next is to provide essential care to infants and children. Okay, to give essential care to infants and children, this community health bag is required, because you are having the measuring tapes, all those things. You can assess and you can give the essential care to them. The next is to provide follow-up services in case of chronic illness. Chronic illnesses like diabetes, for them follow-up services you can give with the help of this one, like periodically you can do the assessment. The next is to demonstrate nursing procedure. To demonstrate nursing procedure for whom? Like students. They're going for the community health posting, community health nursing posting. So they will be carrying the community health bag. So you will be teaching the this bag technique as well as how to perform. So with the help of these only, all the instruments you will be carrying with the help of these community health bag, and you will be going to the community setting, and there you will be taking one place or one home, directly home visit you will be doing, and you will be demonstrating to all the students or group of students. The next is to provide appropriate educations. To provide appropriate health educations, this is required. Okay, health education means you have to teach the family members also, right, related to health things. So it will be helping this. With the help of this community health bag, we can give the appropriate health educations. So these and all the purposes, the reason to use this community health bag. Why you are using community health bag? So for these purposes. The next, moving towards when we are using, when and where to use the community health bag. Like during our home visit, right? During our home visit, for any nursing procedure, to carry out any nursing procedure, we can use this one, community health bag, for demonstration to the students, nursing procedures, as well as for the follow-up advices, follow-up services, and also health education to the families. When we are giving health educations, when we are giving follow-up advices, that time we require and we can use the community health bag. The next, moving towards principles of bag techniques. Okay, when we are as a community health nurse, we are doing the bag technique. We should follow some of the principles. So you see, first one is principles of cleanliness. This bag should not be contaminated. You should maintain the cleanliness of the bag. Periodically you have to clean the bag, and whenever you are going for home visit, you should not keep the bag on dirty places. You should not keep on the dangerous places or contaminated places. You should take care of that one. You should maintain the cleanliness of the bag. Then principles of sterilization. As we know, what is the meaning of sterilization? Sterilization is the process or procedure to kill all the microorganisms. Okay, that also you have to follow. Then principles of protection after care. You should protect the bag from danger areas. Then improvisation. You have to you have to improve the bag technique, as well as the, if anything, like day by day you have to improve the bag techniques as well as the bag improvisation, improve of the bag. Okay, then principles of the restocking. Principles of the restocking is tells what that one, like one home visit, you have visited one home and you have performed some of the procedures, so some of the solution will finish, some of the things will be, some of the cotton will be finished, maybe gauze piece will finish, so you have to replace it again with the new one, because you are going to do another one visit, next family. So restocking should be there. Nothing should be deficient, or no solution bottle should be empty. So you have to replace, you have to restock. The next is principles of economy of material and time. Okay, you need to save materials as well as you need to save the time. Okay, it is helping, as well as bag technique is helping for saving the time. Bag technique is helping for saving the time as well as saving the energy of the nurses. Okay, like for example, if bag is not there, if this community health bag is not there, how the person will do the home visit, and how the person will or nurse will be performing the this one home visit. During home visit, any procedure, any urine analysis, or only she have to go to the home, and if she will find any case, then she have to come back again to the primary health center. Then she have to take some of the instruments, some of the things, then again she have to go to the home, then again she have to do, or else after that again she have to come with the some problems, again some problem will be arising, again some, means coming and going she have to do. So that will be causing what? Energy as well as time wasting. So this bag, community health bag and bag technique is helping for saving the time, saving the economy, and saving the energy. Okay, so these are all the principles of cleanliness, sterilization, protection after care, improvisation, restocking, and economy of material and time. Right. The next, moving towards the compartments of bag. Moving towards the compartments of bag. So in the bag, we are having like college bag also we are having the compartments, right? Side pockets we are having for the water bottle. Then front pocket we are having like small pockets, one or two. Then big pockets, two or three for the, sometimes for the laptop compartment is there, and the big two compartments will be there. So like this only in the community health bag also we are having the compartments. Okay, usually there are two compartments, inner and outer compartments. Okay, all pockets of the bag should be kept on the clean surface. You should not keep on the dirty place or dirty surface. You should keep all the bags in clean surface. So you see how the community health bag is. See, inner pocket also, upper compartment, down compartment, the outer also we are having the compartment, outer side pocket also we are having, and outer one front pocket also we are having. Okay, so now we are going to study which and all compartment, which and all, like upper compartment, what and all the articles you have to keep, down compartment, what and all the articles you can keep, side pocket, what and all articles you can keep, and outer compartment, what and all outer these items, articles, materials you can keep. So this is the design, this is the technique. It should not be like upper compartment items should be down compartment items should be upper compartment. It should not be like that. What compartment, which compartment has made for which one, you should keep, and you should place all the materials, all the articles at the perfect place. So this is called the bag technique mainly. So now we are going to study this one only. So you see upper compartment how it is. So you see now outer compartments. So two outer pockets will be there at the opposite side of the face of the bag, like side pocket, like as like water bottle pocket. Okay, water bottle pocket in the college bag, school bag we are having, no, like that only. Outside pocket is there, two pockets. So one side, one outer pocket carries what and all, spreadsheet. Spreadsheet is nothing but you can take one newspaper and you can keep. Like for what purpose? We are taking the newspaper and we are spreading the newspaper on the surface, and we are keeping that bag on that newspaper. Spreadsheet and health education materials will be there at the side pocket. Paper bag will be there, apron will be there, fetoscope is helping for assessing the or auscultating the fetal sound. Fetal sound is the baby sound, the pregnant woman, the who is the baby is growing in the mother's womb, like mother's uterus. So that sound, that baby sound, fetus sound, auscultation, this fetoscope will be helping. The stethoscope, vision testing chart, that is Snellen chart, growth chart, recording items, that is diary, that is then recording items, diary also can be, or else family folder also can be. Then pencil, pen, scale, measuring tape, etc. So these and all items will be present in, you will be keeping in one side pocket. Then next side pocket, second outer pocket, two side, two water bottle, like two water bottle pocket, like it will be there. So one side we will be keeping that items. Now second pocket, second outer pockets carries hand washing articles, okay, like soap with soap dish, towel, scrub brush will be there. Hand washing materials will be there in a polythene cover, in a polythene cover. And the rack pieces and specimen bottle. Rack pieces is nothing but one old cloth, or else you can take it as a small towel or small handkerchief, okay, for drying the hand after washing. Then specimen bottle, okay, any specimen bottle, like for the urine or for the these, this is okay, etc. The next is inner pockets. So inner pockets usually the cleanest compartment, okay, cleanest compartment contain articles and supplies for procedure which are to be carried out as strict asepsis, okay. Strict asepsis should be followed, like for any kind of um, like urine test, blood test, anything so we are doing means, that is the strict asepsis techniques we have to follow. And in this compartment, this cleanest compartment will be carrying all those materials for, which is for some of the tests which is we have to follow, we have to perform under the strict asepsis technique. That is two artery forceps, thumb forceps, scissors, metal blocks, gauze, metal box, then gauze, in that gauze cotton swab, dressing pad, and two steel bowl, blade, syringe, and needle to each, needle will be there to each. Then microscope slide will be there, slides, that is one box slide should be there, one roller bandage should be there, one adhesive tape, one roll will be there, adhesive tape one roll you can take. Then mask too you can take, you have to keep in inner compartment, and gloves too, okay. These and all the items will be where we will keep, the cleanest compartment, the inner pockets. The next is one inner compartment contains articles and supplies for procedure which are to be carried out with general principles of cleanliness, like urine sugar articles, okay, that is test tube 2, okay, test tube 2, test tube should be there, test tube holder 1, test tube cleaning brush 1, dropper 1, lighter 1, spirit lamp 1, matchbox 1, kidney tray, okay. These and all are helping for this and urine analysis for the sugar, glucose present and protein present, all those things. Then the articles for checking vital signs, like articles checking for vital signs, all those things, like temperature checking, okay, temperature, pulse, all those things, that one. Then one cover contain tablet paracetamol, tablet B complex, folic acid tablet, tablet mebendazole, ORS packet 2 to 5 packets, then tablet CPM and torch 1, okay. These common medications which and all can be used, that and all medication you have to keep in the one compartment, one cleaner compartment, upper one inner compartment, you will be keeping all those articles, as well as along with these articles for vital signs, as well as in one cover you have to keep all the medications and one torch. Okay. The next is second inner compartment has got various pockets, okay, which carries all solutions. Okay, as I said, solutions for urine checking, like for the presence of glucose checking in the urine in diabetes patients or else hypertensive patients. Okay, so for that we need some solutions to check. That is Benedict solution we need, betadine solution we need, then Dettol solution, acetic acid solution, liquid paraffin we need for carrying out all the procedures. Okay, betadine solution, okay, Dettol solution, acetic acid solution. For how much also they have given 50 ml, 5% acetic acid solution. It is helping for checking the protein presence in the urine. Then liquid paraffin Benedict solution, it is helping for checking the glucose presence in the urine. This is in second inner compartment. Okay, the next is moving to what are the procedures we are commonly performing at home. That is hand washing, urine analysis, vital signs checking, wound dressing, like somebody has fall down and cut it, or else maybe during any kind of work, like minor cut, like not major wound, anything, it will fall down or cut during work. So that time you can, that wound dressing you can do. Then under 5 assessment, that is 0 to 5 years of age children's who and all, that is called under 5 assessment is nothing but for them we are checking the growth and development. Okay, growth mainly, height, weight, and anthropometric assessment. That is these other anthropometric assessment like head circumference, chest circumference, medium circumference, with the help of measuring tape we can check. Okay, the next is physical examination, medicine administration. Medicine administration, like as we saw, so many common medications we are taking with, we are carrying in this bag, like paracetamol, CPM, folic and iron and folic acid, all those things. So this medicine can be administered. Then antenatal examinations. Antenatal examination, that is pregnant mother examination, abdominal examinations and all. Okay, then eye care and vision testing, then steam inhalation and health educations. So these and all the common nursing procedures we are performing at home and during our home visit, and this community health bag is helping for carrying out this one, because we need so many articles, so many instruments to carry out all the procedures, right? Then next, moving to techniques of using community bag, that is how to use the community health bag. Once we are going for home visit, we are going to use the community health bag for carrying out the nursing procedure. So how to use, as a nurse you should know the techniques of these. So first how to do step by step, you see, select a work area where you can keep the bag without any danger or contamination. As we know, the one of the principle of bag ducting is cleanliness, protection, sterilization, all those things. So first of all you will be selecting one home, then you will be checking which area is the safe and which area is free from danger. This bag you will be selecting that one. Then spread the newspaper. Okay, spreadsheet we are having the in the side pocket. You will be taking that newspaper, you will be spreading the newspaper on that, you will be keeping the bag. Then after that, preliminary assessment, you have to do the assessment of the family. What is the need, what is the problems they are having, by interacting with the people of the family member. with the people of family and observation of existing situation to decide the plan of care. Okay, you have to assess what are the needs, what are the problems they are there, and after that only you can plan the care and what are the nursing procedure you have to do, all those things. Then after doing this, after assessment, you decide the plan of care. Then after that, unbuckle the top flap, unbuckle the top flap of the bag and remove the hand washing articles. Okay, hand washing articles. Okay, that is outer, in the outer pocket it is. From the outer pocket, unbuckle the top flap and remove the hand washing articles and go for the hand washing. Next step is go for the hand washing. After hand washing, you open the inner cleanest compartment and remove all the needed equipment from it. Okay, you went for the hand washing, then you washed your hand, you dried your hand, then after that you open the inner compartment, because inner compartment is the cleanest. So before that, before opening that one, you have to wash your hand, right? Then remove all the necessary according to the your plan, what and all equipment, what and all the solution, whatever it is required, you remove it. Then arrange the articles on the spreadsheet. Remember which is called spreadsheet? Spreadsheet is nothing but newspaper. First what you did after selection of the home, you checked, you checked that one where the dangerous is not there, and you removed the newspaper and you spread it on the surface. Then you kept your bag. After that you assess the family, what and all the required, what and all the perform, what you are going to do, you planned. Then you removed hand washing materials and then you went for the hand wash. After hand washing, you come, you dry your hand and then open the inner cleanest compartment. Then you remove all the articles. Then you keep down like news on the newspaper, arrange it. Then close the inner compartment. Okay, after removing, immediately you have to close. That is because no microorganisms contamination should go inside, because that is cleanest compartment. Then close the inner pocket. Then carry out all the nursing procedure, whatever you are going to do, like urine test, blood test, whatever you are going to do, you do carry out your nursing procedure. Then give health education during the procedure. When you are doing the procedure, give health education to them based on their needs, based on their conditions. Then on completion, discard all the waste materials, whatever the waste material like gauze piece or else cottons. So many things will be waste after the procedure. So you discard that waste properly, or else we are having the paper bag. In that paper bag, in the side pocket, you remove the paper bag and you keep the waste in paper bag. Then you can use in the, you come back after the home visit in the primary health center, then you can throw in the where, in the bins. Biological based management, we know, hospital based management, we are having the different bins. You can waste, you can discard. The next is articles from the cleanest compartment should be washed and wash all the articles. Okay, whatever the cleanest from the cleanest compartment you took, like test tube holder, whatever these and all, whatever you removed, that should be washed before keeping again in the bag. Okay, before replacing that one, you have to wash that one. Then dry the articles and replace the articles in the inner pocket first. Okay, the cleanest compartment articles, whatever you remove, that you washed, then dry it, then replace it. Then do after replacing it, you close all the inner compartment, all those things, then go for the hand washing and replace the hand washing materials. Then totally close the bag after hand washing materials kept. Then record the procedures. After that, record the procedure, whatever the procedure you have done, you record it. whatever the result has come, whatever you have done during the home visit, all those things, record the procedures, inform the family member about the next visit, means when you are going to come for another visit, like after 1 week or after 2 weeks or after 1 month or after 2 days only, inform the family for the next visit. Then carry the bag on your shoulder. Okay, when you are carrying your bag, you are carrying as like a handbag. You are carrying the bag as a handbag, so you are keeping the bag on shoulder. You carry the bag on shoulder and replace the spreadsheet on the inner pocket. It's nothing but you take the bag and take on your shoulder, carry on your shoulder the spreadsheet, that is newspaper, you spread it on the surface, on the floor or down wherever you kept that paper. You take, then you keep, like paper, how you will keep the surface which touches the ground, that should be inside, the when you are folding, and the where you kept, which surface you kept the bag, that should be outside. Okay, then you keep or replace the newspaper or spreadsheet at the side pocket. So this is the techniques to use of community health bag at the community health settings. It means when you are doing the home visit, when you are carrying the community health bag, this is how you should use. The next is care of bag. How to care of bag? As we know the principles of all those things. So this is only how to care. Keep away from heat, moist, dust and rain. No dangers, no harm should be there. You should protect the bag. As a nurse, you should do this, all those. You should keep away from heat, moist, dust and rain. And it should be replenished with drug dressing and other supplies according to their consumption. Is nothing but what? Replenished means what? Replaced or restocking. Okay, if one home visit you have done and paracetamol has given to the family members, you have administered or it has been finished, or ORS packet has finished, so what you have to do? After coming from there, once you are going for the next visit, you have to replace that all the drugs, all the ORS packet, whatever has been finished, then full with this, then you go. Then dressing materials or whatever it will be finished, you should replace or restock in that bag. Then should be cleaned once in a week. Okay, you should clean the bag once in a week. It is including removing all the articles. You have to remove all the articles from the bag onto a clean towel spread over a table, then washing and drying the bag, then labeling the bottles if needed. Bottles is something but solution bottles. If solution bottles, label will be going, like it is during cleaning, it is something has gone removed, so you have to label the bottle. Okay, the next is bag should be strictly cleansed and its contents should be disinfected after attending the patient with infectious disease. Any kind of infectious disease, I mean, during home visit, so many patients will be there, so many different kind of patients will be there, infectious patients will be there. So once you are visiting the patient, any infectious patients, you are attending any infectious patients, after that, once you are finished, you should strictly clean that bag, because it is also carrying the contamination, the microorganisms. If you are not cleaning, that may spread to others. Okay, you have to clean the bag and its content should be disinfected. Okay, so to prevent the growth of microorganisms and to prevent the disease spreading. So hereby we have studied bag technique. We have studied the community health bag and community health bag, that is bag technique, and purposes, when to use, how to use, what is the technique of use, and studied the how to care. Okay, so this is about the back technique. I hope you will get some knowledge, you will gain some knowledge of this one, back technique. So today's class has been completed, this topic has been completed, and thank you to all for listening the class and cooperating.